I'd like to begin by acknowledging the traditional owners of the lands on which each of us are meeting today. For me, that is the Wurundjeri Woiwurrung people of the Kulin Nation. I would also like to acknowledge the traditional owners of the lands and waters across Australia and pay my respects to elders past and present, and to all Aboriginal and Torres Strait Islander peoples, including members of the stolen generations. And you might like to put, I know we're meeting from around the country, you might like to put in the chat what lands you are based on, so that we can all see that information. First, a little bit of housekeeping about Zoom. At the conclusion of this talk, we will have some time for Q&A. If you have any questions, you can submit them throughout the seminar using the chat function, which can be opened up by using the chat tab at the bottom of your screen. Today's seminar will be recorded and uploaded to our website within a few days. But please keep in mind, if you turn your video on when asking a question, your image will be included in the recording. So today we will be hearing from Dr. Cherie Hugo of the Lantern Alliance, and I'm very pleased to have you here today, Cherie. Dr. Hugo is an accredited practicing dietitian with 25 years of experience. She founded the Lantern Alliance in 2013, a national aged care collaboration and action-based research initiative based at Bond University, focused on improving older Australians' quality of life through the joy of good food. Dr. Hugo is part of the Australian Aged Care Quality and Safety Commission's National Standards Guidance Reference Group, and currently serving as the Food, Nutrition and Dining Advisor. In the past 6 years, Dr. Hugo has translated her research into an industry-endorsed aged care food, nutrition and mealtime experience ratings tool, Epicure, which offers a way for aged care homes to prioritise areas of need within the aged care food, nutrition and dining experience as mapped across the aged care quality standards. So today, Cherie will be presenting on smart dining, how data raises the bar on aged care cuisine. Welcome, Cherie, and over to you.
Many thanks, Frances. I also begin today by acknowledging the traditional custodians of the land on which we meet, but I meet in particular the Yagamba people, and pay my respects to elders past and present. I extend the respect to Aboriginal and Torres Strait Islander peoples here today. So before getting started, I'm keen to, I'm one of these people that just want you to do a quick activity with me. I know that's brave on Zoom to do that, but you can all just start by closing your eyes. And so even if your camera's off, I want you to close your eyes and go along with me with this short little exercise. So I'd like you to think about a memorable mealtime. So one that you've had in the last couple of years. So go back to that moment and observe the surroundings, the company you were with, the location, the time perhaps, what time of the day, and finally the food that you were eating. So I want you to reflect at that memorable moment, that meal, what feelings you hold around, I guess, the moment that you've had. And so I'm wanting you to just hold on to that memory. We're going to come back to that in a moment. But yeah, we can open our eyes and we'll get started. So I want to first thank Jess and the team for the invite to be presenting here today. It is a real privilege to chat with you all. I'm the founder of the Lantern Alliance, so we are Australia's only transdisciplinary action-based research community of practice focused on improving the quality of life of older Australians through the joy of good food. So what we do with Lantern is all around a few different aspects, partly around obviously research, and we'll be sharing some of that, some of the data insights that we're seeing at the moment. Also around education and advisory services. So Epicure is one of the key tools, along with Explore, which is a consumer experience tool around food and nutrition in aged care. That Lantern sort of is supporting aged care homes and journeying with them around raising the bar around food and nutrition. So I think the first thing to really highlight before we get started, and I'm sure you're all living and breathing it in each of your different roles when it comes to aged care and that environment, is certainly the food and nutrition system in aged care is a complex adaptive system. And many of you will be working in that space and really, I think, then layering on top the current sort of, major industry reforms and shifts in with the quality standards. There's a lot of moving pieces happening, and it's really trying to help navigate with homes a way of really providing those data-driven insights to be able to guide sort of with data and wisdom and innovation to really get that outcome of really a healthy, brighter, nourished population of older Australians. And hopefully today some of the insights will show it is possible. But I'll stop talking and just share my screen so we can get started. And sorry, we do this I'll share with the sound. Okay. Can I just confirm that the screen is showing again?
Yeah, we can see that.
Yeah.
Awesome. Excellent. Yeah, so today, sort of the title, Smart Dining. So it's really just showing how those data-driven insights can really raise the bar around food, nutrition, and dining experience. So some of the messages today, and again, coming to a space of, with participants that are certainly interested in research. This is gold to be chatting with you today. And you certainly, I'm sure, align with the fact that we know that if you can't measure it, it's really hard to manage any area that you're working. And certainly in our space, food, nutrition, and dining experience is no different. The second message is really the one around using the right tools for the job. So, ensuring that when we're looking at that complex space, we're using tools that are designed to help navigate and manage complexity. And the third is around when we get that sort of formula right and sort of those tips right, it really leads to a win-win-win opportunity for not only aged care residents, but also providers and the government at large. So one of the key kind of insights, and obviously we've been going for quite a long time, certainly before the Royal Commission came along, but certainly one of the things that came out through the Royal Commission, we can see, and certainly the data, and we're chatting with residents, family, and sort of the community at large, is food is one of those things that's used as the barometer for overall quality of service of the home. So, if we get the food right, typically the overall perception of that home is a lot better than if the food isn't good. We see that in the media a lot, something that, I'm called in to comment on when, there might be, say, poor performance highlighted with, for instance, in the last week, for instance, with the food, the feedback around resident experience, the government feedback around resident experience. It's something that, we're all familiar with eating, so it's something that's very much tangible when maybe other things in the care aspect aren't so tangible for people to grasp onto and identify, is this a good service or not? The importance of it is certainly getting raised, I guess, as we head towards July this year with the new quality standards. The quality standard 6, which is around food and nutrition, is certainly bringing the role of food and nutrition to the forefront. The thing that we point out, and certainly the toolkit that we've developed, is looking across, as much as we've got it now, quality standard 6. It's actually food nutrition is relevant, and there are aspects that are important across all 7 factors, quality standards, not just quality standard 6. Certainly the aged care star ratings, and as that evolves and the algorithm gets sort of stronger, what we're seeing is, the connection between a lot of those markers used in the aged care star ratings to drive that final rating does link back to food and nutrition. And so those aspects are putting further pressure on providers to be very mindful and really moving towards prioritizing food and nutrition. So I think that we can say this is good news. I think, it's something that in terms of Lantern, we've been advocating for a long time, and the importance of, when we get the food right, many of the other clinical factors fall into place when it comes to the quality care. We say it's good news, but I think it's also can be viewed as bad news by providers. And I think kind of what we're wanting to kind of really share, and at opportunities such as today's presentation, is seeing the value in putting some extra effort into pushing the value of food and nutrition, because the outcome translates across many different factors, including the all-important financial factors, which is an important factor within business. So it really, I guess today's really just sharing some of more of the data and a bit of a quick flyover Lantern as a whole, and how we've landed on the tools that we now use and journey with homes around. So the foundation behind Lantern, the vision, is all around improving the quality of life of older adults. There's lots of aspects. We've done lots of meetings. So typically Lantern has held, over the last 11 years, monthly community of practice meetings. So usually between 100 and 150 attend that. We have over 1,500 stakeholders, and that's a really good diverse mix of stakeholders, from aged care CEOs through to clinical managers and allied health and catering managers and lifestyle teams. So it's a really good diverse mix, which is one of the key pillars of Lantern, the importance of having that diversity and looking at problems from those different perspectives. So lots of insights have happened, I guess, been made and been given through those conversations over that time. So part of those insights we try and share on. We try and identify what are pain points within the system at any one time to then, provide sort of support. So one of those is certainly in the last few years has been with COVID and some of the lockdowns and their experience, how they've impacted the experience of food and nutrition. So I'll share one of the videos. This is just something we put out to help homes just to look at that connection that we see when we're gathering data around increased malnutrition across residents who are dining alone. So I'll share that video. see, there's a lot of simple tips, and I know it's some of those, for certainly those that are involved in hospitality, it feels like, you know, stating the obvious. But sometimes it's those little tips that we're seeing have the largest impact when it comes to sharing them. And, you know, they're doable things that sites go, yeah, we can put that in place. And even if it's drip feeding one at a time, they are aspects that have larger impact. So across the food and nutrition system, we've explored a lot of topics over the last 11 years. This is an example. Each of these points is a lantern meeting that's been had. So there's a lot of different topics, and kind of just shows again the number of touch points and the complexity that can be the aged care food, nutrition and dining space. But within each of these areas, so whether it be, you know, within the kitchen, within food procurement, through to equipment within the kitchen, through to how food's, you know, delivered, and the, you know, those aspects across the food service system, through to the dining room layout and aspects within the dining room setting, ambience and that customer service aspect, through to supporting residents and assisting at meal times, through to, you know, dentition, to the ability for a resident to swallow and ultimately to be nourished from the food. There are so many touch points that can kind of be weak at certain sites, that it's really identifying where are there weak links within a home's food nutrition system to be able to address it and to really move forward. So coming back to that statement, if you can't measure it, you can't manage it. The purpose behind sort of the Explore app and the Epicure program that we deliver with homes across a few years is all around sort of measuring what matters to guide success. And so it's not just a hunch, and we're not sort of just getting feel good, yeah, this is working. We've got a lot of data behind the organisations we work with. Many of those touch points as to how that performance is occurring, and, you know, every 6 months when we're measuring those touch points, when strategies are put in place, how is a home responding, and how is the performance across the system reacting to those aspects. So within Epicure, there's many touch points. There's aspects that engage the key staff members across the home, from catering managers to the site manager, through to the clinical staff and the education officer and finance, the finance officer of the organisation. Each of those roles is asked. We ask targeted questions, very simple questions for those specific roles. But that information comes in addition to our team capturing nutrition, so doing nutrition assessments across homes, dining room observations across all active dining rooms, and consumer experience, to really give a bit of a sense of how the home and the system's working at any one point in time. So I thought today, just to bring to life, you know, I can share, you know, that's what we do, but what does it actually look like? In terms of, we measure these things, where does that actually go, and what does that performance actually look like to a home? So I thought I'd hone in. We can present as like across a whole organisation, like a large organisation, and what that's looking like across the whole home. But I thought we'd start with just a simple regional home in a beautiful location. It's a pleasure to visit this site. This home has 5 dining areas and a cafe. And to date, the last visit was in August, and we're about to go back on site for our 4th visit, but we've been there 3 times. And this site, across those 3 visits, we've captured around the 16,000 data points of information. And again, those data points come from specific staff questions that we're gathering before we step on site, through to information we're gathering through nutrition assessments and dining assessments and consumer experience across the site. So this site has had a lot of just, you know, some of the side benefits that we kind of are capturing, because I think they're things that are important that don't always get surfaced in general conversation. But what we're seeing kind of when it comes to this site in their engagement and this quality improvement process is they've had a significant drop in their complaints. And when that comes down to what's important for a home, that really translates to staff time. So there's less staff time being spent on managing complaints. It also translates to potential changes in performance with the star rating. And certainly in terms of the responses to questions like resident experience questions, such as, do you like the food here? This site very much has fed back around reduced food wastage observed, particularly over the second and third visits. What we're excited to see is it's less food wastage through more consumption. So it's not, it's just basically less food in the bins and more in the bellies of residents, which is all about, which is fantastic when it comes to nourishing residents. We're seeing also significant saving in food costs. So it's something that we've raised. Back in 2017, I published a paper around aged care food spend, which got quite a lot of traction in terms of within the Royal Commission and certainly in the media, and has led to interesting responses from government in terms of tracking food costs. So what we've seen is certainly over the last few years, an increased awareness of how much homes are spending, and now we have to publish it. You'll see it on My Aged Care with any home, what their current per resident per day food spend is. What currently is being viewed as is positive is the higher the food cost, the better the outcomes. But what we're actually seeing when we're measuring data and following a system is it doesn't necessarily correlate. So yes, you can't cut food costs down, but if you're procuring properly and you've got enough skill within the team of the catering, then you actually can cut food costs. And this home's a great example. I think their average per resident per day food spend was $15 a day when we started, and it's actually reduced to around $11 a day, which might be looked at negatively at the moment from a government point of view, but this home's also tracking beautifully in terms of nutrition. So it's showing kind of that it can be done even as food costs come down, because there's better trained staff and smarter ways of working. So this home also, as much as we've not at this home actively gone in to reduce supplement spend, some of the key strategies that they've landed on as a result of the data has reduced the supplement spend. So in effect, they've got savings of around $73,000 per year just through that change alone. We also know that there's happier residents and happier staff. We're measuring consumer experience, and the staff turnover has certainly adjusted with this site. And nice to hear general managers feedback at the end of visit, and in this instance is after some training. The support has given a significant boost to our catering department. Passion and positivity are infectious and can truly transform a struggling department into a thriving one. And thriving it is. I'll share some of the I guess nutrition markers that we're measuring at this at our visits, but certainly in this home. So again, we've been to this site 3 times. So baseline at 6 months and 12 months, you can see that in terms of the nutrition data, malnutrition certainly is reversible. And I think one of the big things that I say probably 100 times a week is around the fact that malnutrition is something that it's not inevitable. It's something that most cases are preventable when we're actively putting proactive strategies in place. So this has improved their nourished proportion of residents by 20% at last check, and looking forward to stepping back on site to see where they're at currently. In terms of those pie charts, when we remove the impact of new residents moving into the site, say at that 12-month visit, we're looking at just the ongoing residents. So the residents that have been there for each of the visits, so over a 12-month period, what we're seeing is they're long-term residents compared to published data where you'd expect sort of around 6% improvement in nutrition across a resident population in aged care. What they're seeing is 50% improvement across their resident population of those who are malnourished. On the flip side, their regression rates, so their nutrition regression rates, the published figures are around 23%. What we saw at this home at the 12-month mark is a reduction of 6%. So great upward shift in improved and downward shift in regressed. So other factors, so if we bring it back to, say, the quality indicator reports, you know, we ask them what's at their last check, what their figures are looking like in terms of the unplanned weight loss. You can see a nice trend happening there between visit 2 and 3. So quite pleasing downward trend there overall. We also can see that falls and hospital readmissions can be reduced. So we can see again, if we look at the quarter before we stepped on site to start measuring performance, the quarter before we stepped on site, their total falls was 79. And at the quarter before we stepped on site for the 3rd visit, it had nearly halved. So that's the reported falls. And hospital admissions, again, pleasing, it sort of had pretty much dropped by 2/3 comparing quarters. So we also can see when it comes to wounds, there's certainly, I've got the wrong wound, but we do have wounds, and I can certainly share the wound data. But what we can see, here we go. I don't know what's happened there with that slide, but what we saw with their wounds, again, their chronic wounds significantly reduced. This home's got a wound care nurse that's been there for around 5 years. She comes 3 times a week and has been just blown away by the amount of wounds that have resolved between in that period of 12 months compared to the previous few years. So again, wound care costs and certainly pressure injuries is something that is costly in terms of care costs and obviously to quality of life for residents. In terms of consumer experience, only good positive trends seen there too. So a reduction in the negative reported consumer experience stories. And I'll go through a little bit around how we capture that data and an increase in the positive experience. So an increase of 42% in their positive and strongly positive experiences. So if we look at, say, a larger home and how that looks, so this home certainly is a lot larger. This home we've been to 3 times. We've captured it because it's larger. It's a lot more data points, around 39,000 data points. And the thing that's of interest with this home is, again, measuring the same data set each time. What we've seen, this home took a different approach. They were developing a model of care, and they were wanting to measure and test it before rolling it across the rest of their organisation. This area, so because it was a large home, they'd chosen to implement this model of care within their dementia-specific areas, and this really had a focus around food. It involved residents preparing meals and really actively having that engagement. And what we saw when we were comparing across site is the areas that were part of the model of care improved dramatically in terms of nutrition. And just keeping in mind, these are residents living with dementia. These are very much, this is showing, I guess, where we can have a shift. And a lot of these residents remained. It wasn't like a new a turnover in resident population that shifted this. This is looking at largely a stable population at this site with these figures. So there were 38% nourished when we first started, and at the third visit, it increased to 86. This is something that's, amazing and has many different impacts across the system. So for that organisation, that home, what we saw is, looking across the visits, this translated to 31 residents jumping up a category in terms of nutrition. So moving from moderately malnourished into the nourished category. And just a recap for those who aren't dietitians or interested in sort of what that connection really means, we know that when a resident's nourished, they're less likely to fall. So data shows up times less likely to fall. I'm framing this in a positive. We could say malnourished residents are 8 times more likely to fall and have falls related to, causing injuries. But so nourished residents also are less likely to have pressure injuries, between 3 to 11 times less likely. These are the residents with pressure injuries are more likely to be malnourished. Nourished residents are less likely to have infections. They're less likely to be the frequent flyers, into the hospital system. They're more likely to be independent, and they're more likely, most importantly, to have a higher quality of life. So these 31 residents who have jumped up, this is what we're talking about in terms of influencing a system. Oh. The other thing that's interesting when it comes to nourished residents compared to malnourished is, when it comes to caring for a malnourished resident, it takes somewhere between 2 to 3 times longer to care. So this is talking the aged care workforce and stress on the workforce. Residents who are more malnourished are the residents that we're having to reposition more often, changing wound dressings more often, filling out paper to hospital admissions more often. They're more dependent, they're requiring more assistance. And when it comes to being, that top priority within the workforce of being that top priority within the industry being workforce, this is connected. So before I move off that example model of care site, it's just, again, showing the other areas compared to the model of care areas across that site, and what translated in terms of their consumer experience. So our tool, our consumer experience tool, has been out and been used for around 10 years. Initially, when we were certainly putting it through its paces during my PhD, was tested with dementia experts around, at what point, can we use it for residents living with dementia? And certainly up until mid-stage dementia, we can actively use that tool in capturing narrative, memorable moments around that dining experience. So I want to bring you back to your memorable moment, and just, again, keen to kind of just hear, I'm wondering if perhaps maybe we can use the chat function, but if you can share really what was it around your moment that made it memorable? So if you just look at the little chat bubble, I know that's dangerous to ask, but what made your memory memorable? I'm hoping I don't have a shy audience. Being with family, thanks, Bianca. Social interaction. Christine, family, smell, taste of the food. So that's sensory engagement in the family. Karen, so smells and conversation. Fantastic. So lots of it's around sort of, that connection and what happens, not so much the food's part of it, but there are so many different aspects, and that's often what we see when it comes to those memorable moments. And understanding those memorable moments help us to guide and prioritize a home as to what's the best bet, when there's maybe 100 different things you could possibly do to improve dining experience. The smartest way to really be uplifting dining experience is focusing on what the current population of residents are valuing most. And the technique that we use to do that is the Explore app. So thanks, guys, for those who shared the chat. Appreciate your input. So I think that brings me back to where we're at the moment. And look, 10 years ago, we've moved a lot more, positively in terms of awareness around food. And so it's not criticizing where we're at, but at the moment, kind of one of the key markers of resident experience when it, linked to food within the government toolkit is, do you like the food here? And, I guess there's quite a lot of limitations with what do you do with the answers to that question? And at the moment, certainly they're being publicly displayed. But what we're finding interesting is when we're going into a site and capturing often 40, 50% of a population's consumer experience specifically around food and comparing it to the do you like the food here results, they're not always, it's still not quite kind of capturing, I wouldn't trust it in terms of performance across a home. So consumer really understanding the underlying why is important, and that's what our tool's around. It's the methodology is around self-ethnography. So it's handing back description of that story that's been shared around a memorable moment. So we invite residents, family, staff to share a memorable moment around food that they've had or a meal they've had in the dining, in the aged care home. And then it's over to them to describe what was it that made it memorable. And so we have a framework for that, but I thought it'd probably easier to share a video around the basis of Explore.
We communicate through sharing stories and experiences. It's how we learn and unpack challenging things together. At Lantern, we know aged care food can be a challenging area. Meals can make or break a resident's day. And there are thousands of factors that can influence if a meal is enjoyed. For instance, are the lights on? Are the staff engaged? Does the resident have everything they need for an excellent mealtime experience? The Explore app is Lantern's consumer experience tool. It's an online mobile tool that captures resident, family and staff food stories around the mealtime experience. The Explore app very simply captures a person's observations, views and experiences, and most importantly, how they make sense of them. It captures the context of a mealtime experience through gathering both qualitative and quantitative data. This provides the ability to interact with the scale of numbers alongside the explanatory power of a narrative, creating rich data at scale. With Explore, thousands of people can share their food experiences across homes, organisations, the country and across the globe, with all data available in real time. It collects continuous data, like a journal, and allows large numbers of consumers to share stories related to the same questions at once. Lantern's Explore app is based on 3 key principles around the data. The first principle is self-interpretation. Explore places interpretation with the consumer sharing the story. This empowers the person to interpret and give meaning to their own story. And it's done by asking the participant to answer a range of quantitative questions related to the story they shared, allowing for more authentic interpretation, while avoiding others interpreting a person's story and adding their own cognitive and cultural biases. The power of self-interpretation prevents misinterpretation and bias, whilst empowering people to give meaning to their own story. This increases data validity and the ability to scale by decentralizing story interpretation. The second principle is real-time feedback, and this can be seen as data flows in to Explore's SenseMaker platform. This means you can see the data instantly and act on it while it's still current, rather than waiting for months for it to appear in a report. The third principle is data access. Explore enables organisations to access their own data. Aged care communities can look at the patterns in the data together and decide on what actions to take. This empowers communities to remain in control over their narrative and what to do about it. It's clear traditional surveys lack the ability to gain new and powerful insights. They rely on external interpretation and take time to collate and respond. Whereas Lantern's Explore app unpacks ideas and complex information through the art of storytelling to provide powerful insights to act for aged care homes, organisations, and the industry. To harness the power of food stories to measure and act on consumer experience across your organisation, contact us at lanternalliance.com.au.
So I think that then leads into, what with the data, how to have more impact. And I guess part of our approach at Lantern with organisations is bringing that data back very rapidly. So we will be on site to do the visit each 6 months. The site might be a day and a half, 2 days on site, and then the following day that data is presented back to the organisation. So those key staff are part of that conversation. Sometimes residents are also part of that conversation to help make sense of that data together. So I think it gives that context around seeing patterns in data that we certainly can then further explore and unpack. But it's the importance of really acknowledging that at a site level, the answers often lie within the team that are there day in, day out. They see what would work, what won't work, and really it's part of that co-design process. So part of that process has often been with organisations we work with, establishing across sites nutrition champions. So that's one of the strategies that we use as a way to help kind of increase that vision of looking and being aware and feeding back and really kind of championing that focus around food and nutrition.
So one of the main things that I learned today is that nutrition and dining and the health of somebody, it comes back to the whole experience of not just, what the food looks like on the plate, but how it's presented, whether someone's telling you what you're having on the menu and giving you a relationship when you're eating, talking about the food, not just pretending they're talking to somebody else while they're feeding you, actually joining you in that experience.
When I was a kid growing up, the dining room table was such an exciting place to be. We'd come at the end of the day and we'd download all the things we did in the day, what was the good news, the bad things that happened, and it was just a whole discussion, relationship building time. I can see that happening here within our facilities again if we took the time to sit down with our lovely residents and draw out some of those things. What have you done today? What activities were you involved in? Tell me a little bit about how you grew up and who sat at your dinner table, and bringing those memories back out again. And I think it wouldn't take long. It'd only probably be 10-15 minutes. We can have a really good deep conversation with our residents over a meal.
Oh, I think it was just great that the whole company were able to get together and be able to create change that supports a person-centered care culture and really achieve our strategies that we have as an organisation that give us world-class dining experiences.
That was an abrupt start and end to a video. Apologies for that. So I think one thing I'd love to highlight is that first case study that I shared with those dramatic results. Their key strategy that they went with after the first visit was to upskill nutrition champions across that site. So if you remember back to that case study, the site's 90 beds, so it's not, it's medium sized. That site put through 26 staff through the nutrition champion training, which is pretty stellar effort. We weren't expecting that many for that size site. But what we've seen across that site, in addition to some catering training, which was provided at the very beginning, is really what's behind the clinical shifts that have been seen and the changes in food wastage and those metrics that we're seeing at that specific site. And we wouldn't know that if we weren't measuring it. So I guess it comes back to those messages, you know, if we don't measure it, it's hard to manage it. The importance of using the right tools for the job. And again, you know, I guess the different tools for at different levels of monitoring, but in terms of for providers and certainly conversations with government is, you know, what we're using, you know, using those right tools can guide and really provide not only a benefit at a resident level for residents and their quality of life, clinical outcomes, but also at a provider level with, you know, I guess, reduced reportable quality indicators, you know, the factors that are often dragging that star rating down, also reputation down, and also providing kind of, you know, increasing unnecessary malnutrition related costs to the home. And at a government level, the win is really around the savings, you know, to the healthcare system in tackling and preventing malnutrition, which is absolutely doable. So that's a little bit of a snapshot. And I think in terms of learnings, again, thank you for the opportunity to share. Our next Lantern Alliance meeting is on the 3rd of May. So for those who join in our Lantern meetings or have over the last 10 years, it will be, again, first Friday in May. But yeah, open for questions, and thank you for having me.
Thanks so much, Cherie. That's a great presentation. And I think for me, that's really highlighted how this area is complex adaptive system, and it's so many touch points along the way, not just, you know, what food is on the plate. And really interesting to hear you talk about, yeah, there's just the one resident experience question about, you know, do you like the food or what do you think of the food, where in actual fact, there are so many other different factors that can be captured, I guess, by your tools as well. We had a question in, so there's time for some questions, and we've got a couple coming through in the chat. The first one I think was from Caroline, who wanted to know about whether the visits or assessments are funded by the facilities or external funding.
Great question, Caroline. At the moment, we have, obviously, we've got two streams of conversations going, but very much it's working with proactive providers who are funding this process for themselves. So we demonstrate as much as, yes, it's an investment in time and funding for the organisation. The return on investment, even if we just look at the surface level of food costs, supplement spend, for instance, and impact of some of those malnutrition factors on care costs, is at least a 200% return on investment. So it's, you know, it's not too much of a stretch, but it is having at the executive level the agreement to let's lead with this, and that's what we've been doing over the last few years, and hopefully government will come on board. We're advising to the commission at the moment, but it'd be great to be able to provide and engage dietitians and chefs across the country to capture this data at all homes.
I might, excuse me, get you to stop sharing your screen, then I can see if anyone's got their hands up or their camera on. But we do have a couple of other questions in the chat. So Bianca, great presentation. Bianca's question is around cultural diversity. How do we integrate cultural foods within residential aged care, and if it's been done, what was the effect?
It adds to the complexity, but it's absolutely something that every home has to grapple with, and certainly moving to the new quality standards, that's going to be an expectation. We see homes doing it. If you did read last week, sort of the Telegraph, there was a great spotlight around a Greek home in Sydney that has really kind of focused around meeting cultural needs, but at regional sites, so again, the site that is in the case study is a great example of, they have feature meals that sort of focus on residents' cultural preferences, and I think part of it is establishing that line of communication between residents and catering teams, lifestyle teams around, making that part of activity is really, exciting residents around food, having that conversation to then try and test different meals as themed meals across, the cycle of the menu, and having that scope to have that ability to integrate cultural requirements. But it's challenging, and every site's so different.
Perhaps it could be another data point as well, and then you could look at some of the impacts of different strategies.
For sure.
Possibly.
It's a question that we ask in surveys. It's something that we haven't sort of, individually looked at and correlated against, but yep, I can go back and look at it. So good question, good point.
And Judy says, thanks, Cherie, excellent presentation covering lots of dimensions of nutrition, like the link to wounds and falls. Thanks, Judy. Be great to have these tools in publicly funded facilities. Hopefully the government will get on board, from Anna. And Tracy asks, what do you think of the current QI program in terms of measuring nutrition outcomes? What could be done better?
I think Tracy, it's some of that conversation we are back and forth with the department, at relatively regular intervals. I think kind of as any dietitians in the virtual room would probably attest, the unplanned weight loss, weight is a pretty blunt instrument when it comes to, malnutrition. Certainly it's one, like when we're using the SGA in our nutrition assessments, it's one of 26 categories that really link towards then that end assessment of, is the resident nourished, moderately malnourished, or severely. So, but I think in terms of, and I think they're pretty much looking at sort of that process around malnutrition screening would be, and having those processes in place across homes. I think that would be our homes. We have homes simply reporting back to us using the MST tool, and we have that reported back, the proportion when they're weighing, how many residents are they asking the MST question. So it's at least screening and actively looking across the population for risk of malnutrition to act.
Okay, I think that concludes our questions and answers. Thank you very much, Cherie. That was a really great presentation and interesting discussion. Oh, we've got one quick question. Are there any plans to look at the meal services as part of home care packages?
It's such a good question, Jennifer. It's and the thing that I'm noticing most at the moment, and again for dietitians out there in the room, I'm not sure how many of them there are out there today online, but there's a lot of enthusiasm within that sort of space, and certainly it's something that absolutely needs attention in terms of really addressing it to prevent that demise before the potential next step to resi aged care, which is obviously a lot more costly to the government. So I just reread, because I'm not answering your question specifically. Are there any plans to look at meal services that are paid? In theory, the client pays for the food, but the payment is split. We've had discussions with a few providers, but in terms of, it's a space that still needs a lot of attention. So, and more people staying at home, and definitely, as much as yes, malnutrition levels are higher in resi, it won't be long before that's that's not the case anymore. That's
urgent need to watch this space, I think. Okay, well, I'd like everyone to thank Cherie with their clap reactions. You can click on your little smiley down below for a very interesting presentation. And just let you know that our next seminar will be on Tuesday, April the 16th from 12 to 1, when the academic unit will present Associate Professor Albie Elias, who'll be discussing time-restricted eating as a dementia risk reduction strategy. So we'll look forward to that, and thank you very much, Cherie.
Thanks, guys. See you later.